Have you ever come across an anterior abdominal wall defect on fetal scan and paused, wondering is this omphalocele or something else? In this video, we'll walk through a case of omphalocele, break down its key ultrasound features, and help you confidently tell it apart from other conditions like gastroschisis. Let's get into it. Here's a real case. A 13-week pregnant woman came in for a routine first trimester scan. On the midline sagittal view of the fetus, we noticed something unusual, a herniation at the base of the umbilical cord insertion. We paused to ask, is this normal physiological herniation or are we dealing with a pathological defect? By 12 weeks, the physiological midgut herniation should have resolved, so persistence at 13 weeks raises concern for omphalocele. Now let's learn how to identify an omphalocele. Omphalocele is a congenital midline abdominal wall defect where abdominal contents, usually bowel and sometimes liver, herniate into the base of the umbilical cord. The key feature, it is covered by a membrane. On ultrasound, look for a midline defect at the base of the umbilical cord with herniated contents enclosed in a thin echogenic membrane. If the liver is seen inside the sac, it strongly suggests omphalocele. Now here's the big question. How do we distinguish omphalocele from gastroschisis? In omphalocele, the defect is midline, the herniation is covered by a membrane, the umbilical cord inserts into the sac. In contrast, gastroschisis has a right-sided abdominal wall defect. It is not covered by a membrane. Free-floating bowel loops are seen in the amniotic cavity, and the umbilical cord inserts normally. Here's where it gets clinically significant. Omphalocele is often associated with chromosomal anomalies, especially trisomy 13 and 18, and syndromes like Beckwith-Wiedemann syndrome. So always recommend genetic counseling and further testing. Gastroschisis, on the other hand, is usually isolated and has better prognosis despite potential bowel complications. So here's the ultrasound checklist for suspected omphalocele: midline abdominal wall defect, herniated contents within a membrane, umbilical cord inserted into the mass. Consider the presence of liver in the sac, assess for associated anomalies, and recommend genetic testing. And don't forget, first trimester physiological herniation resolves by 12 weeks. After that, any herniation is considered abnormal. So next time you see an anterior abdominal wall defect, use these pointers to make a confident call. If you found this helpful, like and subscribe for more real-world fetal ultrasound cases. Thank you.